Welcome to our comprehensive guide on suturing techniques. Suturing is a fundamental skill in surgical practice, essential for wound closure, tissue approximation, and promoting optimal healing. In this video, we'll explore the most common suturing methods, their advantages, and practical tips for effective application. Whether you're a medical student, a practicing clinician, or simply curious about surgical procedures, this series will provide valuable insights into the art and science of suturing. Let's begin by understanding why suturing is so crucial in medical care, and how mastering these techniques can make a significant difference in patient outcomes. The surgeon's knot is a specialized technique used to secure sutures, especially when tension is present. Unlike a simple knot, the surgeon's knot involves an extra twist in the first throw, providing additional friction and preventing slippage. This knot is particularly useful in areas where tissue movement or stress is expected. By mastering the surgeon's knot, practitioners can ensure that their sutures remain tight and secure, reducing the risk of wound dehiscence. Let's take a closer look at how this knot is tied and why it's favored in surgical practice. The granny's knot is another common knot used in suturing, but it differs from the surgeon's knot in its tying method. It involves a tie in one direction, followed by a second tie in the same direction, and then a third tie in the opposite direction to square the knot and hold it securely. While it can be effective, the granny's knot is generally considered less secure than the surgeon's knot, especially under tension. Understanding the differences between these knots helps practitioners choose the most appropriate method for each clinical situation. The interrupted simple suture, also known as the sling suture, is one of the most widely used techniques in surgical practice. In this method, the suture is passed through both wound edges at equal depth and distance from the incision, ensuring full thickness bites through the skin and subcutaneous layers. Needle penetration should be 3 to 4 millimeters from the wound edges, and each suture is tied with a surgeon's knot. The next suture is placed 8 millimeters apart to close the linear wound, allowing tension to be shared among sutures. This technique is favored for its strength and versatility, especially in areas of stress. Interrupted sutures offer several advantages. Each suture is independent, so loosening one does not affect the others. This independence allows for precise control of wound eversion and adaptation. Excessive sutures can be placed as needed, making it suitable for areas under stress. If infection or hematoma occurs, removing a few sutures may suffice for satisfactory treatment without compromising the entire closure. These features make interrupted sutures a reliable choice for many surgical scenarios. The simple continuous suture, also known as the running suture, begins with a sample interrupted suture. The needle is then reinserted in a continuous fashion, passing perpendicular to the incision line below and obliquely above. This technique provides rapid closure and distributes tension uniformly along the suture line. It also offers a more watertight closure, making it ideal for certain surgical applications. However, a key disadvantage is that if the suture is cut at one point, it becomes slack along the entire length of the wound. The continuous locking suture, also known as the blanket suture, is similar to the continuous suture but includes a locking mechanism. The suture is withdrawn through its own loop, passing perpendicular to the incision line. This locking prevents excessive tightening as the wound closure progresses, making it suitable for long edentulous areas, tuberosities, or retromolar regions. The technique provides a watertight closure and distributes tension uniformly, ensuring secure wound adaptation. Mattress sutures can be horizontal or vertical and are used when tension-free flap closure cannot be achieved. These sutures resist muscle pull, evert wound edges, and bring larger areas of raw tissue into close contact, adapting tissue flaps tightly to underlying structures such as bone grafts, tissue grafts, dental implants, or regenerative membranes. Mattress sutures are essential for ensuring stable closure in challenging surgical situations. The horizontal mattress suture involves passing the needle from one edge of the incision to the other, then back again in a horizontal manner. The knot is tied after both passes. The distance of needle penetration from the incision line and depth is consistent for each entry point, but the horizontal distance on the same side of the flap differs. Needle penetration should be at least 8 mm away from the flap edges. This suture provides broad contact of wound margins and evert skin edges in wounds under tension, such as closure of extraction socket wounds. The vertical mattress suture is similar to the horizontal mattress but differs in depth of penetration. It passes at 2 levels, one deep to provide support at the wound surface, and one superficial to draw the edges together and avert them. When the needle is brought back from the second flap to the first, the depth is more superficial. This technique is used for closing deep wounds, maximizing eversion, minimizing dead space, and providing added support where healing may be delayed. The figure-of-8 suture is commonly used for extraction socket closure and adaptation of the gingival papilla around the tooth. Suturing starts on the buccal surface, 3 to 4 mm from the tip of the papilla to prevent tearing. The needle is first inserted into the outer surface of the buccal flap, then the lingual flap, and again at a horizontal distance. Both ends of the suture are tied, creating a secure closure that adapts well to the anatomical contours. Subcuticular sutures are used when cosmetic results are desired. The needle is passed within the wound, through the lower portion of the dermal layer, and emerges through the subcutaneous tissue. Continuous short lateral stitches are taken beneath the epithelial layer, with the ends coming out at each end of the incision and knotted. This technique holds skin edges in close approximation and leaves a minimal cosmetic scar, making it ideal for facial and other visible areas. Removing sutures is a careful process to avoid complications. The area is first cleaned with normal saline. The suture is grasped with an instrument and lifted above the epithelial surface. Scissors are passed through one loop and transected close to the surface, preventing contaminated suture from being dragged through deeper tissues. The suture is then gently pulled out. Proper removal minimizes risks such as infection, scarring, or stitch marks. The timing of suture removal depends on the area and tissue type. Skin sutures are usually removed after 7 to 10 days, while mucosal sutures are removed between 5 and 7 days. Eyelid and face sutures are removed earlier, at 3 to 5 days. Scalp sutures at 7 to 12 days, and lip sutures at 3 to 5 days. Leaving sutures for too long can result in complications such as sutural abscess, suture scarring, or stitch marks. Leaving sutures in place for too many days can lead to complications. These include sutural abscess, suture scarring, stitch marks, and even implanted dermoid cysts. It's important to monitor the wound and remove sutures at the appropriate time to ensure optimal healing and minimize adverse outcomes. Selecting the appropriate suture technique depends on the wound type, location, and desired outcome. Factors such as tension, tissue type, and cosmetic considerations all play a role. Understanding the strengths and limitations of each method allows practitioners to tailor their approach for each patient, ensuring effective closure and optimal healing. The choice of suture material is as important as the technique itself. Materials vary in absorbability, strength, and tissue reaction. Absorbable sutures are used for internal tissues, while non-absorbable sutures are preferred for skin closure. The right material ensures secure closure, minimizes tissue reaction, and supports healing. Needle selection is crucial for effective suturing. Needles come in various shapes and sizes, each suited for specific tissues and procedures. Curved needles are commonly used for skin and subcutaneous tissues, while straight needles may be used in certain situations. Choosing the right needle ensures precise placement and minimizes tissue trauma. Proper handling of sutures is essential for successful wound closure. Techniques such as maintaining sterility, avoiding excessive tension, and ensuring even bites help prevent complications. Practitioners should always use appropriate instruments and follow best practices to achieve optimal results. Understanding wound healing is fundamental to suturing. Healing involves several phases: hemostasis, inflammation, proliferation, and remodeling. Proper suturing supports these phases by approximating tissue, minimizing dead space, and reducing infection risk. Knowledge of healing dynamics guides suture technique selection. Eversion of wound edges and precise tissue approximation are key goals in suturing. Everted edges heal better and reduce scar formation. Techniques such as mattress sutures are specifically designed to achieve these outcomes, ensuring optimal cosmetic and functional results. Managing tension during suturing is critical to prevent tissue ischemia and necrosis. Techniques like interrupted and mattress sutures help distribute tension evenly. Practitioners should avoid over-tightening and monitor wound edges for signs of compromised blood flow. Proper placement of sutures is essential for effective closure. Sutures should be placed at equal depth and distance from the wound edges, typically 3 to 4 millimeters for skin and subcutaneous layers. Spacing between sutures, usually 8 millimeters, ensures shared tension and prevents gaps. Using the right instruments and handling them correctly is vital for suturing. Needle holders, forceps, and scissors are standard tools. Practitioners should maintain a steady hand, avoid unnecessary movement, and ensure precise placement to minimize tissue trauma. Maintaining sterility during suturing is essential to prevent infection. All instruments and materials should be sterile, and the wound area should be properly cleaned. Practitioners must follow strict aseptic techniques throughout the procedure. Complications during suture removal can include infection, scarring, and stitch marks. Practitioners should monitor the wound, remove sutures at the appropriate time, and use proper technique to minimize risks. Patient education is also important for post-removal care. Cosmetic outcomes are important in suturing, especially for visible areas like the face. Techniques such as subcuticular sutures and precise approximation help minimize scarring. Practitioners should consider patient preferences and anatomical factors when choosing suture methods. Different anatomical areas require specific timing for suture removal. For example, eyelid and face sutures are removed after 3 to 5 days, scalp sutures after 7 to 12 days, and lip sutures after 3 to 5 days. Following these guidelines ensures optimal healing and reduces complications. If a wound becomes infected or a hematoma forms, removing a few sutures may offer satisfactory treatment. This approach allows drainage and reduces tension, promoting healing. Practitioners should monitor for signs of infection and intervene promptly. Preventing suture scarring involves proper technique, timely removal, and patient care. Using fine sutures, avoiding over-tightening, and ensuring precise approximation all contribute to minimal scarring. Educating patients on wound care is also essential. Minimizing dead space is crucial for preventing infection and promoting healing. Techniques such as vertical mattress sutures provide support at different depths, drawing edges together and reducing dead space. This ensures better tissue approximation and reduces complications. Achieving a watertight closure is important in many surgical procedures. Continuous and locking sutures are particularly effective, distributing tension uniformly and preventing leakage. This is especially important in oral and maxillofacial surgery. Mattress sutures are designed to resist muscle pull, ensuring stable closure in areas subject to movement. This is particularly important in oral surgery, where muscle activity can disrupt wound healing. Proper technique ensures secure adaptation of tissue flaps. Suturing techniques must adapt tissue flaps tightly to underlying structures, such as bone grafts or implants. Mattress sutures are particularly effective for this purpose, providing broad contact and secure closure. This promotes healing and integration of grafts. Extraction socket closure requires specialized suturing techniques such as horizontal mattress and figure-of-8 sutures. These methods provide secure closure, prevent tearing, and adapt well to the anatomical contours of the socket. Proper technique ensures optimal healing. Adapting the gingival papilla during suturing is important for periodontal health. Figure-of-8 sutures are commonly used, starting on the buccal surface and ensuring secure closure without tearing. This technique maintains tissue integrity and supports healing. Continuous subcuticular sutures are ideal for cosmetic closure. The needle passes within the wound, through the dermal layer, and emerges through subcutaneous tissue. Short lateral stitches beneath the epithelial layer provide secure approximation and minimal scarring. The instruments used for suture removal include scissors, forceps, and needle holders. Proper use of these tools ensures safe and effective removal, minimizing tissue trauma and preventing complications. Practitioners should always use sterile instruments and follow best practices. After suturing, patient aftercare is essential for optimal healing. Instructions include keeping the area clean, monitoring for signs of infection, and avoiding unnecessary movement. Proper aftercare reduces complications and supports recovery. Managing complications such as infection, hematoma, or scarring requires prompt intervention. Removing affected sutures, draining hematomas, and providing appropriate wound care are key steps. Practitioners should educate patients and monitor healing closely. In summary, mastering suturing techniques is essential for effective wound closure and optimal healing. Each method has its own advantages and applications. From interrupted and continuous sutures to mattress and subcuticular techniques, understanding the principles and practicing proper technique ensures the best outcomes for patients. Practical tips for suturing include maintaining sterility, choosing the right technique and material, and ensuring precise placement. Practitioners should always monitor the wound, adjust technique as needed, and educate patients on aftercare. These tips help prevent complications and support healing. Advanced suturing techniques may be required for complex wounds or specialized procedures. These include layered closure, tension-reducing methods, and cosmetic approaches. Practitioners should stay updated on best practices and continue to refine their skills. Reviewing suture techniques regularly helps practitioners maintain proficiency and adapt to new challenges. Practice, feedback, and ongoing education are key to mastering the art of suturing. By staying informed and skilled, clinicians can provide the best care for their patients. Thank you for joining us on this journey through suturing techniques. We've covered the most common methods, their advantages, and practical tips for application. Remember, mastering suturing is a blend of knowledge, skill, and practice. By understanding the principles and refining your technique, you can ensure optimal outcomes for your patients and advance your surgical expertise.